Welcome to our discussion on HIV/AIDS, a critical global health issue. HIV, or human immunodeficiency virus, targets the immune system, specifically attacking cells that help the body combat infections. When untreated, HIV can progress to AIDS, acquired immunodeficiency syndrome, which is the most severe phase of the infection. As of the end of 2021, the World Health Organization estimates that 38.4 million people globally were living with HIV. In that same year, approximately 650,000 individuals died from AIDS-related illnesses. These figures underscore the persistent need for education, prevention, and treatment initiatives. Despite advancements in research and treatment, HIV/AIDS remains a significant threat, especially to vulnerable groups. Today, we aim to enhance understanding of the virus, its transmission, and prevention methods. The information provided here is for educational purposes and is not intended as medical advice. If you're concerned about HIV or your risk of infection, it's crucial to seek personalized guidance and testing from a healthcare professional. Let's explore the signs and symptoms of HIV, which can vary widely from one person to another. Initial symptoms often mimic those of the flu or other common viral infections, including fever, fatigue, swollen lymph nodes, sore throat, headache, muscle and joint pain, and a skin rash. These symptoms, part of what is known as acute retroviral syndrome or ARS, typically manifest within 2 to 4 weeks after exposure to the virus. However, it's important to note that some individuals may not experience any noticeable symptoms during this early stage. As the infection progresses, the immune system becomes increasingly compromised, heightening susceptibility to opportunistic infections and other health complications. Without appropriate treatment, HIV can develop into AIDS, characterized by a severely weakened immune system and a higher risk of severe illnesses that wouldn't typically affect those with healthy immune systems. Understanding how HIV is transmitted is crucial for prevention. The virus spreads through the exchange of certain bodily fluids, such as blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. Common transmission routes include unprotected sexual contact, including vaginal, anal, and oral sex, with a higher risk during anal sex due to the fragility of rectal tissues. Additionally, sharing needles or syringes for injecting drugs provides a highly efficient transmission route, allowing HIV-infected blood to directly enter another person's bloodstream. HIV can also be transmitted from an infected mother to her child during pregnancy, childbirth, or breastfeeding. While rare in developed countries, HIV transmission through blood transfusions still poses a risk in some areas due to less rigorous screening procedures. It's important to clarify that HIV cannot be transmitted through casual contact such as hugging, shaking hands, sharing utensils, or using the same toilet facilities. Moreover, HIV is not spread through air, water, insects, or saliva. Section 4. Causes and basic pathology of HIV. HIV is a retrovirus, a type of virus that uses RNA as its genetic material. When HIV enters the body, it targets CD4+ T cells, a specific type of white blood cell that plays a crucial role in the immune system. The virus attaches to the surface of the CD4+ T cell and fuses with its membrane. Once inside the cell, HIV uses an enzyme called reverse transcriptase to convert its RNA into DNA. This DNA is then integrated into the host cell's DNA, allowing the virus to replicate and produce new copies of itself. As HIV replicates, it destroys CD4+ T cells, gradually weakening the immune system. The decline in CD4+ T cells makes the body vulnerable to opportunistic infections and other diseases. Opportunistic infections are infections that rarely cause illness in individuals with healthy immune systems, but can be life-threatening for people with compromised immunity. Section 5. Prevention and awareness. Preventing HIV transmission involves a combination of strategies aimed at reducing risk behaviors and promoting safer practices. These strategies include using condoms. Consistent and correct use of condoms during sexual activity provides a significant barrier against HIV transmission. Condoms are highly effective in preventing the exchange of bodily fluids that can carry the virus. Pre-exposure prophylaxis, or PrEP, is a medication that can be taken daily by individuals at high risk of HIV infection. PrEP works by blocking the virus from establishing an infection in the body. Post-exposure prophylaxis, or PEP, is a medication regimen that can be taken after a potential exposure to HIV. PEP must be started within 72 hours of exposure to be effective. Harm reduction programs. Needle exchange programs and other harm reduction services aim to reduce the risk of HIV transmission among people who inject drugs. These programs provide sterile needles and syringes, as well as education and support services. Raising awareness and promoting education are crucial in combating the stigma surrounding HIV/AIDS and encouraging testing and early treatment. Public health campaigns, community outreach, and educational initiatives play a vital role in disseminating accurate information and promoting responsible behaviors. Section 6. Conclusion. HIV/AIDS remains a significant global health challenge, but with advancements in treatment and prevention, people with HIV can live long and healthy lives. Understanding the virus, its transmission routes, and prevention methods is critical in the fight against HIV/AIDS. By promoting education, reducing stigma, and encouraging testing and early treatment, we can work towards a future where HIV/AIDS is no longer a public health threat. It is essential that we continue to support research efforts aimed at developing a cure for HIV and improving the lives of people living with the virus. We all have a role to play in preventing HIV transmission and supporting those affected by the virus. By staying informed, practicing safer behaviors, and advocating for compassionate and effective policies, we can contribute to the global effort to end HIV/AIDS. Remember, knowledge is power, and by working together, we can overcome this challenge.